Q-Rious.
Hey, let's explore belly before getting the vaccine.
I heard that it works to reduce the side effect after getting vaccinated, such as headaches.
Huh? Where did you get the news?
Online, it's pretty reliable.
What a nonsense to believe that thing. Did you think like that? But in fact, this ridiculous information is holding a place deeply in people's lives. Of course, several fact-checking websites are running to prevent the fake news, and they put efforts to increase people's low health literacy. Fact-check verification can reduce people's fears from the fake news, and it can also provide correct information to people. However, have you ever visited a fact-checking website?
Never in my whole life.
So do I. I've never used a fact-checking site before preparing for this project. Likewise, even though the fact-checking sites are already in operation, it is not working effectively due to the low accessibility. Therefore, we would like to propose a groundbreaking program, Q-Rious, which uses QR code technology to increase accessibility.
Are you all curious about Q-Rious? Then
Follow us!
We will explain the Q-Rious program through an example. First, as you can see, we will choose the information that is interesting and helpful to improve health literacy proven on the fact-check site. And if it contains medical jargon, we will change the words to make it easier for people to understand. Then, produce promotional stickers with an answer for the question and attach them to public transportation. If you scan a QR code in the attachment, you will be provided a link to a website that can give you detailed information, such as verification methods and the evidence data. The following websites are potential partnerships which will serve high-quality information that existing at no particular cost. Thus, Q-Rious program can provide fact-check news and promote fact-checking sites by attaching stickers to public transportation.
Among the various information technologies, there are three main reasons for using QR codes. First, there is a high level of familiarity. QR codes have already been utilized in various places such as marketing, logistics, and etc. And it is deeply embedded in Korean life. In particular, the Korean government implemented an electronic access list policy using QR codes during the COVID-19 quarantine process, making it more familiar for the entire nation. Secondly, QR code is convenient for both development and usage. It can be produced easily and quickly, and smartphone users can easily access the QR codes using cameras. Thirdly, QR code is cost-effective. QR codes are free to anyone because the inventor did not exercise patent rights, hoping many people to use. Public transportation was selected as a medium because it is a cost-effective promotion tool. Due to the characteristic of public transportation, the repeated exposure of promotional materials can happen, resulting in a significant promotion effect. And it also has economic benefits due to the low cost of production, installation, and management. Furthermore, because it has many users regardless of region, age, gender, and country, the information can be effectively exposed to various population groups. To sum up, first, QR codes, a technology that people are familiar with, enables us to expose correct information more familiarly. Secondly, it is cost-effective to use existing resources such as fact-checking websites, QR code technologies, and public transportation systems. Finally, using public transportation as a medium for promotion is helpful to reach all demographic groups. Korea was selected as the primary target for the program. However, it is also possible to expand and apply to other countries with high smartphone penetration and developed public transportation.
Well, that's very reasonable, but do you think it is feasible? How can you make it?
hang in there. We'll tell you how to bring this to reality now on.
The goal is to expand the scope of implementation to Seoul, metropolitan cities, and the whole country. First of all, in areas with large foot traffic in Seoul, QR codes will be attached to buses and subways to operate pilot projects. After that, based on feedback through data analysis, it will be supplemented and expanded to large cities and across the countrywide. Next is the method of evaluating the effectiveness of the program. First, we will assign different QR codes according to the information to tag the QR code access rate, which is an indirect indicator. Through this, we will analyze which places are of high interest or which regions have high program effects and apply them to the next step. If the number of views of a particular places is high, we'll use the places next time more or attach more QR codes to areas with a higher QR code access rate. Meanwhile, direct indicators are intended to be verified by surveying people who have obtained information through QR code scanning. While the indirect indicator shows the improvement point in implementing the next project, the direct indicator will show whether the program has helped people get the right information.
Of the $50,000 budget, $38,100 will be spent on bus promotional materials. Promotional stickers will be attached to 500 buses for 1 month. $11,500 will be used for subway promotions. 200 frame promotional materials will be attached to the subway train. The remaining $400 is a variable cost.
Have you solved your curiosity or curious a bit now? Finally, we will analyze limitations and offer some suggestions to overcome them.
First, there is a limit to the data that supports project. We found little data and research on health literacy, the spread of fake news is related to COVID-19, and the accessibility of fact-checking sites by people in Korea. Therefore, we propose a full investigation into the information behind the policy at the national level, as many policies related to COVID-19 infodemic implemented. There is also a limit to the application of technology within the target country. For a population of 7% who do not use smartphones that still exist, programs using QR codes may be less accessible. Considering that health literacy is closely related to socioeconomic levels, and the smartphone non-users distributed at relatively low socioeconomic levels, QR code technology may block access to information from low health literacy groups. Therefore, it may intensify the health disparity.
Through these programs, we can expect the effect of improving health literacy and preventing the spread of misinformation. It will deliver the right information with easy and simple practice in advertisement. But above all, by introducing fact-checking site, it will lay a sustainable foundation for all citizens to continue to access reliable information and improve health literacy. Wow, this is so nice, but we are still going to Pork Belly.
Sure, cause it's my favorite. Let's go!